Gavana yangu ni Profesa Peter Nyang'nyong'o. Rate yake nampea rate ya A. Sababu gani? Kazi ile anafanya ni kazi ingine inafurahisha wakaji wa Kisumu sana.
Nyang'nyong'o anafanya kazi poa, amekuwa akisaidia town, siku hizi ni safi, uchafu wametoa, zebra crossing ni safi, town amepanguza vizuri sana. Rating naweza mpea A, amepita hiyo hesabu, ameshinda wote mwenye nimejua, gavana wote.
Mimi Gavana Joe naweza mrate katika scale ya B kwa sababu amejaribu kidogo, si sana hivyo. Manake ukiangalia utendaji kazi, amefanya kazi ndio vizuri sana zingine, lakini mahali anatoa no point ni hapo Kibarani. Watu wanalalamika barabara ndogo, yeye kama gavana ashirikiana serikali kubwa ile barabara ipanuliwe. Mahali pa kutupataka Mombasa hatuna.
Nampatia B+ kwa kazi ambayo amefanya. Joe amefanya mengi. Isipokuwa kuna wale ambao walikuwa wanajaribu kumpinga kuleta takataka, wamwage takataka, lakini Joe anajaribu, anatoa hizo takataka zinamwagwa mbali. Tunajua upinganizi wako wale ambao walikuwa wanataka kumchafua jina ili ionekane kwamba afanye kazi, lakini amejaribu.
Mimi ningependa kupatia Gavana Joe grade E kulingana na kazi ambayo amefanya Mombasa. Ni tulimchagua tukiwa na haki ya kwamba atatutendea. Kwanza nataka nisungumzie masuala ya usafi. Mombasa inanuka. Ningependa kumpatia E nikiendelea kusema ya kwamba katika mpangilio wa town center ambao umerundika na magari na matukutuku ambao tunaona ya kwamba town yenyewe haina mpangilio.
All right, so those are just some views that we collected independently here at KTN. And of course, the survey also tried to focus on the Big Four agenda by the government. And I want to focus a bit on the uptake of NHIF here in Nairobi, which is the least also. And I want to engage you, Mr. Mwaro, on that. It's rather alarming, because first Nairobi has the National Referral Hospital, and also you'd assume, being the capital, that we have more awareness here. So why do we have this case of, the least uptake of NHIF?
So much for that. And it's a good thing that you brought the clip to begin with, because now we know where the grades came from. People being randomly asked in the streets, what do you think your governor has gotten? Somebody says A, the other one who's angry may say E, and that's why we find this report a bit funny. Anyway, on the issue of NHIF uptake, of course, first of all, it's a national program,
right?
Because it emanated from President Uhuru's initiative. What we are supposed to come in as a county is to find and make it possible for it to be able to roll out more better. But then again, I know there is the issue of polio and all these other programs that are running. The issue for us, because we have more health centers, more than the other cities, that has been brought up. Maybe it's the issue of sensitization. And what are the priority areas? What the Governor, Mike Sonko, has done is to prioritize Mama Lucy and Mbagathi and Akina Pumwani in terms of making them build the capacity to be able to handle more people. Mama Lucy, by the way, last year, in his predecessor's time, was handling 450 patients a day on average. Now we are close to 1,000, right? So now, and again, Mama Lucy can also now generate its own oxygen. It has an oxygen plant. We are doing a renal center at Mbagathi Hospital. So I think the focus for now, before he now gets to proper running after the new budget, is to try and make sure that the hospitals that can be able to get the offload from the national referral hospitals are in a capacity to be able to handle those kind of patients. So when it comes to rollout of NHIF, then maybe basically it's a sensitization issue. And I think with due course, once there's a budget line for it, we are going to go to the slum areas, we are going to go to Huduma centers, and we are going to make it happen.
Right, and I just want to stay with you, Maura, on that particular issue, because universal healthcare is not just an agenda that President Uhuru has, but it's a global agenda. And as a county assembly, you are mandated to put the county executive, in check in terms of making sure both there's access and also affordability. So from where you sit, are you comfortable that the best is being done to ensure that residents of Nairobi have access, both financially and physical access?
Financial access is not a function of health. Financial access is an economic function whereby we spread and make the economy grow so that people, first of all, can be able to pay for those NHIF services in the first place. However, when it comes now to what the county government intervention comes in, the bigger issue for the current government is how do we make the available health centers that are spread across the county more accessible, have drugs, have the services that are required so that they can handle especially the more outpatient issues. When it comes now to the more inpatient and the ones that need bigger budgetary allocations, then that's where NHIF really becomes much more needed. Right. So I think as a basis and a foundational level, I think the governor has first of all started with the basics. First of all, let us have the enough staff in the hospitals. Secondly, let us pay our debts with the Kenyan Medical Supplies Agency so that drugs can be facilitated and can be brought in regular supply, whatever, in those various health centers. And then now let's move into making sure, because we can give you cards of NHIF, and then you go to hospitals that do not have the basic essentials, maybe they do not have the drugs, then what's the point? And we'll just push our citizens to private hospitals, which will not have saved the day. We want to make sure that the county hospitals and the county health centers and the clinics at the various levels within the county wards are functional in the first place. Then we can now move to the bigger issues that will be affecting the citizens of Nairobi.
Right, and Mr. Motom, one of the areas that really citizens across the counties that were polled were generally dissatisfied with is the quality of feeder roads in all these three cities. And it's something that especially Nairobi residents voted most poorly in terms of how satisfied they are. What do you think, where do you think we keep getting it wrong? You know, we have all these agencies that have funds to keep improving all the different roads that we have. So where do we keep getting it wrong?
First of all, I must say the key factor in every administration is governance. When a particular administration fails in governance, every sector dwindles down. And in this particular Nairobi, we have a challenge on the issue of governance. And I've said that, and I'll say it again and again. It is time governance is seen in Nairobi. The issue of feeder roads, if you see the devolved functions of the county governments from the previous county government, devolved functions, which were given by the national government, the county governments, feeder roads are functions of the county governments. And I've always said, I don't understand why every governor who takes over a seat from another governor will always blame the predecessor on the challenges affecting a particular area. Look at this example. Before Governor Mike Sonko came into office, we had a budget, which I was a member of the assembly. Chege Moro was a member of the assembly. We refused to pass that budget under Kidero because it was not itemized budget. When Governor Sonko came in, he made sure the budget was realigned according to the understanding of the county assembly. Afterwards, we passed that budget. And that budget was specifically itemized, that these feeder roads must be taken care of. Immediately, the governor came in and said, now, all those projects which were done, they were done fraudulently. Ultimately, that's why we are seeing now, instead of putting up roadmaps and checks and balances to achieve what the predecessor had put into action and plan, even with the budget that himself has passed, he's still saying, no, this budget is not mine. My budget will come 1st of July, which means it will be in the second year. So the feeder roads of Nairobi, number one, needs to be a priority. Yesterday I said, maybe as assembly, we need to decide which legislative agenda are we bringing. Because for 8 months down the line, I've never seen any legislative assembly emanating from the executive side, asking us to enact a legislative agenda based on the issues that are affecting Nairobians, in particular the feeder roads. Looking at Donholm Road, I see Donholm Road daily on Facebook, daily being supervised at night, daily supervised midday, daily supervised in the morning. But this Donholm Road was an initiative of the previous government. It's just because the residents of Donholm are so keen. When you go to Muhoho Road, it's an initiative of the previous government. It's good. The current government has an obligation, not to the previous government, to the citizens of Nairobi, to deliver what they serve. And under the devolved function, Feeder Road has no question about it. A day before yesterday, I was along Barclays Plaza. I found a contractor patching potholes there. And I asked him a question. My friend, you are doing this job contracted by the county government or a private entity? He said, I'm contracted. Then I said, how much are you paid to do this patch hole? He told me, I'm paid 40,000 shillings per cubic meter. And I asked him now, when I see the standard of this job you are doing, you are erecting graves in the CBD instead of sorting the mess. Today I passed there, literally there are graves along Barclays Plaza. You don't differentiate between a CBD road, which is a feeder road, and a road in Makongeni Estate. Definitely there's a problem of governance, and governance must come into play so that we understand that this county has to work for the people, not for the previous government.
I think you've made a point, and I want to cross over to Kisumu now. And Mr. Omolo, this particular poll indicated that Kisumu residents are really the most food insecure among the 3 counties, with 26% having not eaten for the whole day in the last 12 months. What are some of the factors leading to this worrying situation?
Well, thank you, Sharon. I want to believe that the biggest cause of that level of poverty is the nature of the county we have compared to Nairobi and Mombasa. Kisumu is both a city and a rural county. So poverty levels generally in the country are very high in the rural areas. And because of that, you will find that if you went ahead and dissected that statistic, you'll find that majority of those numbers reside in the rural areas. Now, when you look at our rural areas, there are a lot of challenges. Kisumu relies on sugarcane, which has been the main income earner for the rural community. That sector is under a lot of strain right now, and that could be one reason why most farmers, like the entire Nyando, Moroni, rely on sugarcane. That sector is dead. Secondly, now we have something coming up in the name of the revived Kisumu breweries. Farmers are now being contracted to grow sorghum. Hopefully, when that kicks in, a bit of that will be addressed. But the biggest challenge we have in Kisumu County is that in the outlying areas, that is in the villages, we don't have enough opportunities for farmers to do something to earn a living. In the urban centers, we still have a challenge in terms of the number of factories and employers within the CBD. We're still struggling in that area. So we need to have a lot of investors coming in. And I think part of the challenge that we expect the new governor, Professor Anyang' Nyong'o, to deal with is to spur investment in this area. That requires lobbying and ensuring that Kisumu is a good investment destination. And I want to say there are already signs that things are looking up in that direction. Issues such as land that have been very emotive, investors have been fleeced. I think something is being done to ensure that is sorted out. So I think on the positive side, that is good. Lake Region Economic Bloc is now being centered in Kisumu. Hopefully that also changes the fortunes of this area in that respect. But you can clearly see that it's difficult for this region to address the issue of poverty when these indices are with us. And of course, Kisumu is also prevalent to malaria. Diseases actually continue hurting the common man because you have to decide whether to buy food or seek medication. So again, if we are able to address some of the challenges as the report has addressed in terms of the NHIF uptake, then I think we should be able to, in the long term, change that negative trend.
Right, critical insights that you give there, Mr. Omolo. And when we come back to Nairobi, we have to talk about the business environment because Nairobi County really is a heartbeat, it's Kenya's heartbeat of Kenya's economy. And I want to talk to you, Mr. Mwaura, in this sense. And this particular poll indicated that 33% felt that there are very high fees for business licenses. Not only that, that there are too many licenses that are charged, and also harassment from county officials. Now, I know you've poked holes in this particular study and perhaps don't have so much faith in it, but what is your independent thought about the ease of doing business in Nairobi?
I didn't poke holes just because I don't like the report, but it's because really the report it can't hold water. But then when it comes to doing business, it's our business. You know, it's important as a county leadership. We try and make it as easier as possible for people to be able to do business, and that's the fairest thing to say. However, there are licenses that were in the previous government that were amalgamated together to get what is called a single business permit, which brought in the issues of fire, brought in the issues of advertising, so that initially members of public used to pay these different licenses all together. But this time round, they pay it in one at a go. And that is also not something that started yesterday. However, we feel the fact that there are others that we feel that are more expensive. When Governor Sonko came into place, the issue of Mamamboga cess, which was being charged 50, and I'm saying that as somebody whose half of my electorate are hawkers, that a particular charge was dispensed with. And I think that is somebody, if we are not going to score him on that, then I don't understand what it means to say that we have done nothing when it comes to his business. Mamamboga used to, whatever the wares you are, you had to pay 50 shillings. Now you are not supposed to pay anything. Do your wares and go home, go and feed your family. When it comes to the bigger businesses, then what we need to ask ourselves, do we want something more so that in the event that we have fire disasters, we have a pool of money that can be coming out from the same businesses? The same governor now is pulling up a fire station equivalent to the one we have in Nairobi in a place called Molem in Kariobangi. Recently, he's also commissioned one that is going to be done in Waithaka, in Dagoretti. And these were in areas where the land had already been grabbed and allocated. In fact, in the one in Molem, there was a building up there, and I remember it was shown in the television when the demolitions happened.
Right.
No one is going to talk about that.
Right.
But if you look at any single fire disaster in the county now, the response is much faster. If you look at the recent one in Sarit Center, there were 0 casualties. If you look at the response of ambulances, has improved by a very great extent.
All right.
So my point is, when it comes to responses, and this money must come from somewhere. So if there's a general feeling that is a bit punitive, then we'll look at it as an assembly and we'll downgrade it with
all right.
due course.
I really have to cut you short now, but you've made your point. That issue about response and how fast and all that is a conversation, an entire one on its own for another day. But I want to read a few responses from our viewers before we wind up the show. And IG Waswa says that Nairobi is choking in floods, garbage, corruption, and bad roads, not to mention poor services in its public institutions. But there's a positive one here, rather in support of the government, saying that Beatrice Elachi is right. Let's not compare Nairobi with Kisumu and Mombasa. Nairobi should be compared with Johannesburg. I'll read perhaps one last one. So many of them I have. And, okay, maybe some of them I cannot read right now, but many thanks for your comments. Keep them coming. We can have the conversation going on online. And I want to thank you so much for joining us tonight on The Big Story. And I'll see you again tomorrow. Many thanks for watching. Thank you for my guests as well, joining me here in studio and in Kisumu. Have a good night. I'll see you tomorrow.